some fun stuff this weekend. Anyone? Yeah. I'm going to celebrate with my daughter, who took a huge test today, and she did amazing. Oh. Okay. So anyway. Welcome to our voting list number 5. It is Friday, February 21st, 2025. This is the Health and Government Operations Committee, and we have some bills we are about to vote. Is there any objection to the withdrawals? Move the withdrawals. It's been moved and second. Any discussion or concerns? All those in favor say aye. Aye. Any opposition? They've been withdrawn. House Bill 11, Delegate Semple Hughes, Health Insurance Access to Non-Participating Providers, Referrals, Additional Assistance, and Coverage. It came out favorable with amendment. It is Lisa and Collison. Lisa.
This bill alters existing requirements on health insurance carriers regarding referral procedures for non-participating specialists and non-physician specialists. The bill also repeals the termination date for chapters 271 and 272 of 2022, which require specified carriers to cover mental health or substance use disorder services provided by a non-participating provider at no greater cost to the member than if the services were provided by a participating provider. There are amendments that have been distributed that clarify the circumstances under which a carrier is required to make a referral to a specialist or non-physician specialist for a member seeking mental health or substance use disorder care under certain circumstances, and provide that if a carrier approves a certain request for a referral, the carrier may not require utilization review other than what would be required if the covered benefit were provided by a provider on the carrier's provider panel.
Collison, Vice Chair Collison.
Thank you, Madam Chair. I want to thank Delegate Semple Hughes for really working on this. This is an area that she's really passionate about, and in terms of getting people the mental health and substance abuse support that they need, given our current shortage. The amendments remove the financial or the fiscal note, so this can be done under current practices. So I'd like to move the amendments.
The amendments have been moved and second. Is there any discussion or question on the amendments? Delegate Hill.
Thank you. So, Madam Vice Chair, Ben Steffen mentioned in the testimony that insurers are not listing, they don't list out-of-network provider fees for these behavioral health services as they do for somatic. Does any of the amendments address so that they also have to list those fees?
No, because what they're doing is they're doing a lot of one-to-one contracts.
Okay.
They're not doing, standard fees.
Okay, thank you. Thank you, Madam Chair.
Any other questions or discussion? Seeing none, the amendments have been moved. All those in favor say aye.
Aye.
Any opposition on the bill as amended? It's been moved in second. Any questions or discussion on the bill as amended? Seeing none, all those in favor say yes? Yes. Any opposition? Okay, I thought I would throw you off. Okay, let's see, it does have amendment. Who does not want to be a co-sponsor? Okay, wonderful. So let's go to House Bill 73, State Finance and Procurement, State Leasing of Real Property. Favorable with amendment. Lindsay and Kerr.
This is a departmental bill from DGS. As introduced, it did three things: raise the size limit for real property leases exempt from state procurement law from 2,500 square feet to 5,000 square feet, decrease the number of days that DGS must advertise a need for the state to rent building space from 30 days to 20 days before proposals for a lease are due. And then the third thing was that the bill would have repealed a requirement that proposed leases be advertised in daily or weekly newspapers and required instead that they be posted on the DGS website and on eMaryland Marketplace. The subcommittee adopted an amendment that's on page 3 in your packet to retain the requirement that proposed leases be advertised in daily or weekly newspapers in addition to posting on the DGS website and on eMaryland Marketplace.
Delegate Kerr.
The discussion on the amendment ended up in a split vote. However, the amendment passed, was adopted, and the bill as amended passed unanimously. So I move the amendment.
Second. It's been moved and second. Any questions or discussion on the amendments? Seeing none, all those in favor say aye.
Aye.
Any opposition?
To the amendment?
Yes. Okay. Okay, opposition to the amendment, Shalega? Okay, thank you. Oh, and Chisholm. Okay, thank you. Okay, the bill as amended, is there a motion? It's been moved in second. Any discussion or questions on the bill as amended? Seeing none, all those in favor say aye. Aye. Any opposition? Seeing none, the bill passes, and it's a departmental bill, cannot allow co-sponsors. Let's go to House Bill 331. Delegate White Holland. Public Information Act, Public Access, Ombudsman, Delegation of Powers, favorable with amendment. Lindsay and Kerr.
This bill authorizes the Public Access Ombudsman to delegate to a staff member of the Office of the Public Access Ombudsman any of the powers and duties granted to the Ombudsman. There's an amendment on page 5 in your packet, adopted in subcommittee, which clarifies that the delegation must be appropriate to the staff member's training and expertise.
Delegate Kerr.
Thank you, Madam Chair. Everyone on the committee was good with the amendment. We adopted the amendment and passed the bill out of subcommittee unanimously. I move the amendment.
Second. So the amendments have been moved in second. Are there any questions or discussion on the amendment? Seeing none, all those in favor of the amendment say aye. Aye. Any opposition? Seeing none on the bill as amended? It's been moved in second. Is there questions or discussion on the bill as amended? Seeing none, all those in favor say aye. Aye. Any opposition? Seeing none, wonderful. Who does not want to be a co-sponsor? Okay. So let's go on to House Bill 367, Delegate Martinez. Health Occupations Board's English proficiency requirements and licensure by endorsement for nursing, favorable with amendment. It was Lindsay and Rosenberg. Lindsay.
This bill prohibits a health occupations board from requiring an applicant to provide additional evidence of English proficiency if the individual holds a valid unrestricted license, certification, or registration from another state that requires such evidence for licensure, certification, or registration. As introduced, the bill would have required each health occupations board that requires evidence of English proficiency to maintain on its website a list of other states that have an English proficiency requirement that meets the board's requirement. The bill also alters English proficiency requirements for the State Board of Nursing and State Board of Pharmacy. For the Board of Nursing only, the bill clarifies that an applicant may hold a valid unencumbered multi-state license under the Nurse Licensure Compact as an alternative to providing the evidence required under existing law in order to qualify for licensure by endorsement. There's an amendment on page 6 in your packet adopted in subcommittee that removes the requirement that each health occupations board maintain on its website a list of other states that have the English proficiency requirement, and instead requires those boards to prominently maintain on their website a statement that an applicant may not be required to provide additional evidence of English language proficiency if the applicant holds a valid unrestricted license, certification, or registration from another state that requires evidence of English proficiency for a licensure, certification, or registration.
Thank you, Lindsay. Rosenberg.
Thank you, Madam Chair. Bottom line, this bill provides that if you have a license from another state which requires English proficiency, our state board cannot require any additional proficiency in English. It was unanimous within the subcommittee.
Okay.
Move the bill.
Move the amendment.
Move the amendments.
The amendments have been moved in second. Any questions or discussion on the amendments? Delegate Riley.
Thank you, Madam Chair. So on this, do we know how many states actually still require? Because some of these states could have already eliminated it as well. Do we know within that list what states still require the English?
No, I don't know.
Okay.
We don't have that answer,
Okay, thank
but
you.
we'll ask, see if we can get it before the floor.
Okay, thank you very much. Appreciate
You're
it.
welcome. Delegate Kipke.
Thank you, Madam Chairman. Just a question to the subcommittee, or whoever should answer the question. What problem are we solving with this bill?
Presumably, people were,
Yes.
people were being asked to demonstrate their proficiency when they had already done so.
So the original
It was
state.
redundant.
Okay.
Just a follow-up to that. Do we know if people were being asked to demonstrate proficiency and whether or not they passed? So we're eliminating the state of Maryland's check on this as long as they had passed it in some other state. We don't know how some other state is administering it. So I'm just curious, do we actually know, or could we find out, if people were all just passing? I mean, if everybody was passing, then this would seem to make perfect sense. But if there were people who had this certification from another state, and Maryland's boards were requiring an additional check, were any of those people being required to do, I guess, remediation, language remediation? So I guess that's my question. I bring it up here because it might come up later. Thank you.
Thank you. So my understanding, and correct me if I'm wrong, is that this would apply for people that have obtained their licenses in another state, and the state actually requires that they prove that their proficiency and have taken whatever that requirement is. I would say probably a test. And if they can show in Maryland that they have taken that test and have passed, then they don't have to do it again, right? Because you did it already, and English is English. And that is the understanding. But what I would like to do is I want to ask the library to see the question with Delegate Riley and to see and incorporate yours and see what we can get, okay?
Thank you.
And thank you for the question. It's a good one. Delegate Taveras and then Riley. Okay, thank you. Delegate Taveras.
This is not necessarily a question, just to, I don't think it's so much of a problem as much as the issue is that there might have been people that have accents that are stronger. And so that gave the rise to ask people to take another test. That was unnecessary. That's my thought process in this. I just had a conversation yesterday. I don't know how appropriate it is to repeat it, but the thing is that it was an operation, the person was working in an operations ops unit.
Yeah,
But when the person gave the acronym,
makes sense.
it made it sound like a bad word when they
makes
picked
sense.
up the phone. So the person was told, you got to say the whole section. So it's just small things like that.
Delegate Chisholm, what I'm going to do is I'm going to just hold the bill to let the board answer the questions, okay? Because we may not get the answers by Tuesday unless Delegate Martinez, you have them.
I don't have the answers, but I do have something to add to the conversation. So the amendments that were presented basically conform the bill with the Senate cross-file. The reason why we did this is because, if you remember, the Board of Physicians slided in a nice part-time person that would be required to do all of the research that everyone here is asking for on the website. So instead, we decided, let's just put a statement that says if you passed an English proficiency test in another state that has a compact, we're going to make sure that you don't have to retake it. I can understand some concerns around what those tests are, what the proficiency rate of passing those tests are. We want to make sure whoever is providing care in our state can provide it to anybody at all. I think we all can agree to that. So I can get those answers for you. But in terms of how many states and things of that nature, they were saying it will cost $50,000 for the state to figure that out. So I don't know if we have the time necessary for the library to figure out that, which is why we eliminated it from the bill. But I think by the time it's on the floor, we can get the questions that the minority wants answered.
Okay. Delegate Chisholm.
On that point, I would just like to know, is the English proficiency test universal? Meaning or does each state have a different test? Because if it's universal, obviously it'd be crazy to ask them to do it twice.
Delegate Martinez.
I don't know if it's a universal test or a singular company that does the test, but English is English, and so it might not be the same, but I'm sure the tests rhyme, right? And I'm sure they are somewhat adequate, which is why all of the health occupation boards were in support, which is why the Board of Nursing is advocating for this. You know, we have to also understand we have a nursing shortage, and so we want to make sure that we're pipelining as many competent professionals into Maryland as possible to take care of all of our constituents. And so I think this bill just adds another feather in our cap to allow us to get the workforce that we know we have a shortage for. So I hope we can move the bill today.
Delegate Shalega.
Thank you. Yeah, I look forward to those answers because according to the fiscal note, under the current law, An applicant for an RN, or LPN, must demonstrate written or oral competency in English. Acceptable proof includes, so this already, you don't have to take a test if you have at least 3 years of enrollment, graduation from an English-speaking undergrad school. Number 2, graduated from a recognized English-speaking professional school. Or number 3, completed 5 years of practicing nursing in another state or English-speaking territory. So this must be a very small number of people that we're talking about. I mean, if they were trained, I know the Philippines has, quite a robust nursing program that they train people from. But if they went to a school where people speak English, if they've worked for 5 years in another state or here. So I'm wondering who is that tiny group that we're trying to solve this problem for?
And look, I was inclined to hold it, but given the $50,000 study going through every state, we're not going to get that anytime in the next 45 days. We do know we have a shortage, and the amendment actually states that if you have taken an English proficiency test in another jurisdiction, I would imagine they have to, prove it. So the question for the board, Delegate Martinez, I'm going to go ahead and take the vote, but I need you to find out from the board, what do they require? How many people are we talking about, right? Given the requirements just outlined as well. If you could get that to us as soon as possible, okay? All right.
That hopefully it's something that is really accessible. I'm sure it is, and maybe even some of us can take the test together. All right, but I think ultimately we want to make sure that. I'm glad all of us did, right? But I'm just really appreciative of this committee and the work that we did on this bill, and I look forward to us getting on a vote.
Okay, Delegate Bagnall.
Thank you very much, Madam Chair. And as I understand it, this just allows us to be a little more efficient with some of that licensure by not being duplicative. Is that correct? Is that my understanding?
Yes, if you've taken the test in a state that has such a test and passed it, we would acknowledge that as we do in other instances.
Thank you very much.
Okay. All right. Riley.
Thank you for second bite. So my good colleague next to me, we were kind of like discussing some things. So just to be clear, if, like my question was, how many other states still have that test requirement? Just give us an idea. So if every state is doing what we're doing and they kind of take away the requirement to do the test, does this bill then say, okay, well, if you don't have the test from another state, then we're going to have you take the test? Is that what this bill still allows, or no? Yes. Okay, that's what I thought. Okay.
And if I may, the fiscal note on page 2 says, under the bill, 2 additional methods for demonstrating competency in English are added. Passing an English proficiency exam approved by the U.S. Department of Health and Human Services, and 2, holding a valid, unencumbered, multi-state license under the NLC. The bill also clarifies that the Maryland Board of Nursing may not require an applicant for licensure as an RN or LPN who is or has previously been licensed in another state as an RN or LPN to demonstrate competency in English as part of his examination or licensing procedure if the other state has an English language competency component rather than a similar English language competency component as part of their examination, meaning, to your question, that they have to have it in order to qualify for this.
Okay, I'm good. You don't have to do no study.
No, I like it. You got me there. You made me read. Thank you.
Good, thank you.
And it's always good to read. I'm glad I know English. Can I tell you, it was hard to learn English because English is my second language, and I'm still learning it. Yeah, there's some words that you see that I pronounce. Like boat, right? Because we don't have the V and the B. So you heard me say boat. It's vote, and I have to tell myself vote or visa. So my kids, I know we're voting, but my kids like to say, Mommy, you didn't pronounce that right. I go, well, I'm glad my dollars worked, and you speak it better than I, right? Anyway, let's go on to voting. Okay, were we on the amendment or on the bill? Okay, let's just say we're on the amendments. They removed in second. Any more discussion or questions? All those in favor of the amendment say aye. Aye. Any opposition to the amendments? On the bill as amended? It's been moved in second. Any discussion or questions? All those in favor say aye. Aye. Any opposition? All right, who does not want to be on the bill?
I don't want to be on the bill, but are we getting questions answered?
Yes, Delegate Martinez is going to get them.
Okay, I'm not going to vote on the bill until I get them.
Okay.
I would like to be shown as not voting.
Okay, that's fine. You can, what is the word? Abstain. Okay. Not a problem. Not a problem. All right. That's it. So just Delegate Shilega. All right. We moved the amendments.
Yeah, we have to move.
Oh, we moved the bill already. So look, we moved the amendments and we voted on the amendments. Then I moved the bill and it was second and we were doing, we took the vote. So on the bill as amended, all those in favor say aye. Aye. Any opposition on the bill as amended? One abstention. Okay, thank you. Oh, co-sponsor, oh, hold on a second. I did not hear it. All right, who does not want to be a co-sponsor on this bill? Delegate Shilega, Delegate Chisholm, Delegate Morgan, Delegate Riley, Delegate Hutchinson, and Delegate Kipke. Thank you for the discussion. It was very lively. All right, so let's go on to House Bill 376. And Delegate Martinez, as soon as you get those, can you please give them to Lindsay and provide them to Shilega? Maryland Cybersecurity Council membership alterations. It came out of subcommittee favorable with amendment. It is Lindsay and Kurt. Lindsay.
This bill requires the governor, rather than the attorney general, to appoint various members of the Maryland Cybersecurity Council and invite as appropriate representatives from specified federal agencies to serve on the council. Additionally, instead of the attorney general or the attorney general's designee serving as the chair of the council, beginning October 1st, 2025, and every 2 years thereafter, the council must elect a chair from among the members of the council. There is an amendment adopted in subcommittee on page 10 in your packet that adds member of the Cybersecurity Association to the council.
Okay, Delegate Kerr.
Thank you, Madam Chair. The bill hearing was sufficient to give everyone a good understanding of the bill. There was no need for any further discussion in subcommittee. We adopted the amendment and moved the bill unanimously. I move the amendment.
Second.
So the amendments have been moved in second. Any questions or discussion on the amendments? All those in favor say aye. Aye. Any opposition on the bill as amended? It's been moved in second. Questions, discussion? Seeing none, all those in favor say aye. Aye. Any opposition? All right, let's move on to House Bill 421, Delegate Johnson, Public Safety 911 Trust Fund 988 Suicide Prevention Hotline. It was favorable. Lindsay and Kurt. Lindsay.
This bill expands the purpose of the 911 Trust Fund to include providing funds for costs related to the operation of the 988 Suicide Prevention Hotline that may be shared with 911 activities. The bill also repeals the prohibition that prevents the 911 Trust Fund from being used for any purpose associated with the 988 Suicide Prevention Hotline and instead prohibits the 911 Trust Fund from being used for any costs that solely support the 988 Suicide Prevention Hotline. No amendments.
Okay, Delegate Kerr.
Last bill, there was no need for any further discussion in subcommittee. It moved unanimously. I move the bill.
Second.
Bill has been moved in second. Any question or discussion? All those in favor say aye. Aye. Any opposition? Seeing none. Who does not want to be on the bill? Oh, no, it's favorable. Sorry. Sorry about that. 423, Delegate Lopez, Public Safety, Maryland 911 Board and Maryland Department of Emergency Management Regulatory Authority. It was favorable. Lindsay and Kerr.
This bill authorizes MDEM and the Maryland 911 Board to adopt regulations to implement and enforce the requirements of state law. There are no amendments.
This one did require a little bit of discussion in subcommittee. Nevertheless, we were able to adopt the amendment and then move the bill unanimously. So I move
It was favorable.
Embry amendment, support, okay,
That's okay.
got it.
It's been a long week.
It has.
Yes.
I'd like to put an amendment on this bill. All right, I move the bill.
Okay, the bill has been moved and second. Any question or discussion? All those in favor say aye. Any opposition? Seeing none, the bill passes. Who doesn't, oh, it's favorable, sorry. House Bill 428, medical debt complaints of money, for money judgment and real property liens, favorable with amendment. Aaron and Kerr.
The bill prohibits the creation of a lien on owner-occupied residential property by contract or as the result of breach of contract for the payment of medical debt. A complaint seeking a money judgment must indicate whether the judgment sought is for medical debt, and a money judgment for medical debt must include the address of the primary residence of the defendant. If a lien is created in violation of the bill's provisions, the court must remove the lien, and the bill's provisions apply only prospectively to complaints filed on or after the bill's effective date. There's a reprint on page 13 of your packet that incorporates amendments that were adopted in Government Operations and Health Facilities Subcommittee. The amendments define medical debt as a debt owed by a consumer to a person whose primary business is providing medical services, products, or devices, or to the person's agent or assignee for the provision of the medical services, products, and devices. And medical debt does not include debt charged to a credit card unless the credit card is issued under an open-ended or closed-ended credit plan offered solely for the payment of healthcare services. The amendment also repealed language that would have awarded economic damages to the owner of the property if there's a violation of the bill.
Delegate Kerr.
Thank you, Madam Chair. I see now in my notes, this is the bill that required the amendment.
Okay.
So as I said before, we adopted the amendment and moved the bill unanimously. I move the amendment.
Second.
The amendments have been moved and second. Any questions or concerns, discussion? Seeing none on the amendments, all those in favor say aye. Aye. Oppose? Seeing none on the bill as amended? It's been moved and second. Any questions or discussion on this bill? Seeing none, all those in favor say aye. Aye. Any opposition? Who does not want to be on the bill because it's favorable with amendment? Okay. All right, Delegate Kipke. Let me just go the order that I usually do. Delegate Shalega, Delegate Morgan, Delegate Riley, and Delegate Kipke. Thank you. So let's move on to the next one, House Bill 455, Delegate Kaiser, Braille Flag Memorial Act of 2025. Favorable with amendment, Lindsay and Kerr.
This bill requires the Department of Veterans and Military Families to designate a location for an American Braille tactile flag to be placed on one or more state veteran cemeteries as authorized by the Secretary to honor members of the Uniformed Services, veterans, and other individuals in the state who are blind or visually impaired. There's an amendment on page 17 in your packet that makes a clarifying change to the preamble.
Delegate Kerr.
Thank you, Madam Chairman. There were no issues in subcommittee. We adopted the amendment and moved the bill unanimously. I move the amendment.
Second.
The amendments have been moved and second. Is there questions or discussion on the amendments? Seeing none, all those in favor say aye. Aye. Any opposition to the amendment on the bill as amended? It's been moved and second. Questions or discussion? Seeing none, all those in favor say aye. Aye. Any opposition? Who does not want to be on the bill? All right, thank you. House Bill 468, Delegate Alston, petitions for emergency evaluation, favorable with amendment. Aaron and Bagnall. This is the little bill that could.
The bill clarifies that an endorsed petition for emergency evaluation is effective for 5 days after endorsement and authorizes a court on a motion by the original petitioner and for good cause shown to extend the effect of an endorsed petition by 5 days at a time for up to 30 days based on the presenting behavior of the individual. Each extension must be based on a separate motion, and an endorsed or extended petition must be served expeditiously, and the court must include on the petition the date the petition expires. A peace officer is authorized to use force in accordance with the Maryland Use of Force statute when executing a petition. There is an amendment on page 18 that was adopted in the Public Health and Minority Health Disparities Subcommittee that names the bill after the Prince George's County sheriffs who died executing an emergency petition.
Delegate Bagnall.
Thank you, Madam Chair. This is in the same posture as it passed this committee and the House last year, except for the amendment. The amendment We held the bill last week because we wanted to get confirmation from the families. They would be very appreciative of the, naming it after them, and so with that, I would move the amendment.
Second.
So the amendments have been moved in second. Any questions or discussion? Seeing none, all those in favor say aye of the amendments. Any opposition to the amendments? Seeing none on the bill as amended. The bill has been moved in second. Any questions or discussion? None. Seeing none, all those in favor say aye. Aye. Any opposition? Seeing none, who does not want to be on the bill? All right, thank you, Delegate Olson, for your work, and Aaron and Bagnell. House Bill 553, Delegate Taveras. Maryland Medical Assistance Program Self-Measure Blood Pressure Monitoring. Favorable with amendment, Aaron and Bagnell. Aaron.
There's a reprint of the bill on page 19 that incorporates amendments adopted in Public Health and Minority Health Disparities Subcommittee. The bill requires Medicaid beginning January 1st, 2026 to provide coverage for self-measured blood pressure monitoring to recipients who are pregnant, are postpartum, or have been diagnosed with chronic kidney disease, diabetes, heart disease, or cardiometabolic disease. Coverage must include the provision of validated home blood pressure monitors. There are amendments that strike the specific definition of healthcare providers and also strike the education campaign that was required by MDH.
Okay. Bagnell.
Thank you, Madam Chair. The amendments actually address the fiscal note. We had a robust discussion about the fact that this is existing practice, and this is kind of a belts and suspenders bill that just clarifies that this is existing practice. And with that, I would move the amendment.
The amendments have been moved in second. Are there questions or concerns? Seeing none, all those in favor say aye. Aye. Any opposition? Seeing none on the bill as amended. The bill is amended. It's been moved in second. Any questions or concerns on the bill as amended? Seeing none, all those in favor say aye. Aye. Any opposition? Seeing none, the bill passes. Who does not want to be on the bill? Delegate Shalega, Delegate Chisholm, Delegate Morgan, Delegate Riley, Delegate Kipke. House Bill 672, Delegate Collison and Palakovich. Carr, School Health and Wellness Personnel Assessment and Maryland Council on Advancement of School-Based Health Centers. Favorable with amendment, Aaron and Bagnell. Aaron.
This bill requires MDH and MSDE to conduct an annual assessment of the school health and wellness personnel workforce in the state. MDH and MSDE must jointly submit a report to the General Assembly on the findings of the assessment by December 1st, 2027, and annually thereafter. The bill also adds a school nurse member nominated by the Maryland Association of School Health Nurses to the Maryland Council on Advancement of School-Based Health Centers. There is an amendment on page 23 that was adopted in Public Health and Minority Health Disparities Subcommittee that require MDH and MSDE to publish the report findings on their websites, and also require MDH to consult with associations of school health and wellness professionals on strategies to improve the recruitment and retention of such personnel.
Okay, Bagnell.
Thank you, Madam Chair. We had a robust discussion on this bill led by our good Delegate Riley, who has been working in the school psychologist space for a long time, and our shared frustration at being able to get the right stakeholders at the table. Ultimately, this bill passed bipartisan, not unanimous, and with that, I would move the amendments.
The amendments have been moved. Is there a second? Moved in second. Any questions or discussion on the amendments? Seeing none, all those in favor say aye. Aye. Any opposition to the amendments? Okay. Seeing none, on the bill as amended. It's been moved in second. Any questions or discussion? Delegate Shalega.
So what problem are we solving here? What's the report going to include?
Delegate Bagnell.
Let me get
or Bonnie.
I was going to say, Vice Chair Collison, if you want to take that while I get the.
So what the report will have is in the bill, listed out all of the healthcare professionals that address needs of students in schools. So that it's school nurses, it's psychologists, it's counselors, it's occupational therapists, speech pathologist, how could I forget that? And I forget It's the whole gamut. And basically, you know, we've been trying to deal with the real crisis around mental health issues, and so we want to make sure that we have enough professionals in our schools to address the needs. And so the report's going to identify for each local school district, you know, in collaboration between the school system and the MDH, the number of people they have in those positions and whether or not they're lacking any professionals. And if so, then work on, and as a result of that data, after gathering that data, the local district is going to collaborate with the local health department, the state health department, and come up with ideas, and also the associations for the different professions, and come up with ideas about how to recruit and retain these professionals in our school systems. It's really about addressing shortages that we have.
So the title of the bill says school-based health centers. Is it just for school-based health centers,
No,
or is it for all?
Thank you for asking that question, Delegate. The reason it's there, that school-based health center is there, because this bill adds a school nurse to the Council for Advancement of School-Based Health Centers.
So this bill's doing two things.
Right.
Well, adding a nurse to a school-based health center, what?
Council for Advancement of School-Based Health Centers.
Okay.
And then doing the data analysis of all of those health professionals.
But the data analysis is not about the school-based health centers?
No, it's every school.
Okay.
Whole school system.
And I'd like to hear what the opposition from the subcommittee was.
The opposition was that Delegate Riley has been trying to get this information about school psychologists, but she has only, the bill that she has put in and worked diligently on, and I think even passed and nothing happened, only working with the Maryland State Department of Education, and they've done nothing. And so that's the reason, part of the reason why this bill exists, because we felt it was necessary to pull in the Maryland Department of Health to make sure that the school systems are actually doing this analysis and this and follow up. So we believe that this is really going to help what Delegate Riley was looking for.
And Delegate Riley, are you still opposed?
I am, because I believe it's expanding it too much, especially with what we're dealing with right now with the deficit. And I know the answers that I received from other colleagues and the other committees, and the cost, you know, is very high. So then we're just going to get the data back, and then what are we going to be able to do with that? So we'll get very frustrated again. I think if it was limited to school psychologists, social workers, and counselors, I think they could be able to get this work for us. And they're the ones who are actually the folks that are in the behavioral health area. Just unfortunately, my bill will never come to HGO, even though it does deal with behavioral health, I believe, and not just, you know, positions in the schools. So that's my frustration with it. So I don't want to expand it at this point because I feel like it's going to go nowhere. My bill was a lot more limited. It just dealt with school psychologists. It went through the whole process, went through all the superintendents, weighed in. And I know this isn't about my bill, but I just know the challenges that, this is going to then have once we get the report back. And then the expense. So then is it going to then, increase like all universal health care in our schools? I'm not for that. So I think that's kind of one of my issues with it as well.
So you think it's the first step to a broad expansion of?
Correct.
Okay. Thank you very much.
Okay. All right. Delegate Bagnall.
Thank you very much, Madam Chair. And I think it's an important first step because it does bring together the Department of Health and the Department of Education. And to to the good delegate's point, one of the frustrations that we all shared, and actually was Vice Chair Cullison, myself, and Delegate Riley, because I mentioned during the subcommittee that I had put in a commission for a number of years trying to bring the Department of Health and the Department of Education together to actually create a universal language, because when you're talking about healthcare in schools, the language is a little bit different than healthcare in a clinical setting. And I think this is getting us to what all three of us have been trying to accomplish for a while. And the other important piece is, because we are going to get, the General Assembly is going to get these reports, this committee is going to get those reports. And this committee is very good at working in this space and figuring out, recommendations and policies that actually do promote expanding the workforce and ensuring that we have the necessary resources for addressing our healthcare needs. So I do appreciate the concern about expansion, but I also think, we are a data committee, and this is going to get us the data that we need to really understand what's happening in our school health care and in our school-based health centers.
Okay, Delegate Hill?
Thank you, Madam Chair.
You're welcome.
Since we're having this discussion on the bill and slightly beyond, I think I'm one of the many other people who have been frustrated when trying to deal with health in the school system, because health issues, for some reason, when they involve children, are no longer our jurisdiction. And it is near impossible to get the Department of Education and the Department of Health to work together in a collaborative way, largely because they each have budget issues and no one wants to use their budget to do the work that needs to be done. So it may well be that, we're not going to resolve that issue with this bill. I think the committee, the subcommittee chair's points are well made, but I would ask for consideration of committee leadership if, over the interim, we can maybe take a deeper look at this problem of how we can have more influence on the health of our children in the schools rather than leaving it up to the Education Committee.
Would you like to lead that subgroup in the summer? All right, so who wants to be on that subgroup right now? Tell me, raise your hand. Delegate Warman, Delegate Riley, Delegate Hill, Delegate Taveras, Delegate Bagnall and Alston. There you go.
There'll be a lot of questions on that subject.
So it's okay, they're gonna check her.
Chair, she has discretion.
No, you gotta stay in. You gotta stay in, we need you. Okay, can you, Michelle, can you make sure, and Gazoni as well, we have a list of work groups that we are putting together for the summer. And you know what, believe it or not, a lot of these bills came out of those, that we had 7 last year. So if we can add that to the work group, that would be great. I think it's important to, it's healthcare related. All right, so let's move on to what did we do on that bill?
I think we were on the amendment.
On the amendments, right? So we discussed the amendments, so they've been moved in second, right? Yes?
Amendment.
Okay, so on the bill as amended, it's been moved in second. All those, any questions or discussion? All those in favor say aye. Aye. Any opposition? I have Delegate Shalega, Delegate Chisholm, Delegate Morgan, Delegate Riley, Delegate Hutchinson, and Delegate Kipke. Okay. All right. So let's move on to the next bill, which is actually House Bill 722. Oh, sponsors. Who does not want to be on the bill? Delegate Shalega, Delegate Chisholm, Delegate Morgan, Delegate Riley, Delegate Hutchinson, and Delegate Kipke. Thank you. 722, House Bill 722, Delegate Rosenberg, Maryland Department of Health report on oversight of substance use disorder treatment program and recovery residences. It's favorable. Aaron and Bagnell.
The bill requires MDH on or before December 1st, 2025 and December 1st, 2026 to report to Finance, B&T, the House HGO Committee, and House Appropriations Committee on the revision of COMAR 1063 on improvements to the oversight of substance use disorder treatment programs and improvements to procedures for the certification, monitoring, and oversight of recovery residences. The reports must include an analysis of how the revisions to COMAR 1063 and other changes undertaken by the department will prevent events similar to those that occurred and were reported related to PHA healthcare, including patient relapse and death while enrolled in a substance use disorder program and housed in provider-owned buildings. No amendments.
Bagnell.
Thank you, Madam Chair. The entire subcommittee felt that this was a really important and urgent effort, and it passed unanimously. With that, I would move the bill.
The bill has been moved in second. Any questions or discussion on it? Seeing none, all those in favor say aye. Aye. Any opposition? Seeing none, the bill passes. Who does not? Oh, no, it's favorable. Sorry. Thought I would try. All right. House Bill 745. Delegate Guyton, State Board of Professional Counselors and Therapists Behavior Analyst Licensure Application. Favorable with amendment. Lisa and Rosenberg.
As introduced, this bill requires the State Board of Professional Counselors and Therapists to issue a behavior analyst license within 10 days after receiving a completed application from a qualified applicant or 30 days after receiving additional information. The board must notify an applicant for a behavior analyst license by email when the board receives the application, begins reviewing the application, determines the application is complete or needs more information. There is an amendment on page 24 of your packet that alters the timeframes for licensure to 30 days after receipt of a completed application and 50 days after receipt of additional information.
Okay, and that is Rosenberg.
This was unanimous on the amendment as well as on the bill, and this is an effort to try and expedite handling of these issues by the board. And perhaps down the road, we'll look at other boards.
Okay, wonderful. Is there any discussion? You want to move the amendments? It's been moved in second. Any discussion on the amendments? See none, all those in favor say aye. Aye. Any opposition to the amendments? See none on the bill as amended. It's been moved in second. Any questions or discussion on the bill as amended? See none, all those in favor say aye. Aye. Any opposition? Seeing none, since it was amended, who does not want to be on the bill? Okay, let's move on to House Bill 869, Preserve Telehealth Access Act of 2025, favorable with amendment. Lisa and Collison. Lisa.
This bill makes permanent the provisions of law that specify that telehealth includes specified audio-only telephone conversations between a healthcare provider and a patient, and that reimbursement for a telehealth service must be made on the same basis and at the same rate as if the service were delivered in person. There are amendments on page 25 of your amendment that require the Maryland Healthcare Commission to conduct a study every 4 years on any new developments or advances in telehealth, and that remove a prohibition on prescribing Schedule II substances through telehealth.
Delegate Collison, Vice Chair Collison.
Okay. Thank you, Madam Chair. So when we passed the original telehealth bill during the public health emergency, there was a big question about how much providers were going to be paid for these services. And the payer market wanted to make those or was interested in keeping those costs lower because, for a variety of reasons, but mostly because you didn't need the infrastructure. And since we did a lot of compromising over that bill, decided that telehealth, which includes both visual telehealth, like we do on our Zooms, and audio only. So in other words, a phone call, for example, they're used very much in behavioral health services, would be paid at the same rate as if the patient was actually in the room with the provider. We looked at that, we said we were going to look at it after 3 years to see what the impact was on the carriers. After 3 years, we didn't have enough data, so we extended it 2 more years. And now we're at the point where we have enough data. The insurance market has not exploded, and they are able to maintain those same payment levels as we've done during the public health emergency. So that's what the bill started out as. That's the original bill. It was, we have 2 amendments here. One, to make sure that we continue to study it, but also keep ourselves updated with the latest technology as we move forward, because we all know that's moving quickly in the healthcare space. And also bring us into line with what the DEA is allowing within the telehealth arena, and that is to be able to prescribe, I guess they're tier 1 drugs, over telehealth as well as in person. In Maryland now, that's not legal, but for states that are following the DEA rules completely, it is legal, and we can move in that direction. So this is just bringing us into line with that. Lots of discussion around that, around concerns whether or not there were guardrails on the practitioners, making sure that the practitioners the particular practitioner is licensed and has the authority to prescribe those drugs to begin with. We have 2 pretty significant guardrails in Maryland. One is our prescription drug management program, and every opioid prescription that goes through a pharmacy is immediately triggered up into this system, so that if the pharmacist sees that this person has gotten opioids from another place more recently, then that prescription is questioned. There's also another body, it's called OSSA, and Delegate Kipke knows what that stands for, and that also keeps these records and monitors what practitioners are prescribing with respect to opioids. All of this works well within the state. So any telehealth that's happening within Maryland, we know for a fact is following all those rules. Then we had a discussion about what happens for practitioners that are not in the state of Maryland. Do they have to follow the same rules? The providers on the call said, the only practitioners who can do that across state lines are those who are either participating in a compact or who have a Maryland license. But any prescription that comes into a Maryland pharmacy is going to be examined and uploaded. So ultimately, there was, we still want to find out more about what can be done across interstate lines. We know that it's okay, just in general, telehealth is okay with folks in compacts and people who have reciprocity and people who have Maryland licenses but may live in Minnesota. God knows why. It's cold there. So we're looking into that, but for the purposes of making sure that our providers continue to be able to use telehealth, we need this bill. So with all of that, I would move the 2 amendments.
So the amendments have been moved and second. Any questions or discussions on the amendments? Seeing none, all those in favor of the amendment say aye. Aye. Any opposition to the amendments? On the bill as amended?
Move the bill as amended.
It's been moved and second. Any questions or discussion on the bill as amended? Seeing none, all those in favor say aye. Aye. Any opposition? All right. Who does not want to be on the bill? Okay. Thank you for your work. House Bill 995, work group to study the rise in adverse decisions in the state healthcare system establishment. Favorable with amendment. Lisa and Collison. Lisa.
This bill establishes a work group to study the rise in adverse decisions in the state healthcare system. The Health Services Cost Review Commission and Maryland Insurance Administration jointly will provide staff to the work group. There are amendments on page 28 of your packet, and they add members to the group and alter the staffing and appointment provisions.
Okay. Thank you, Lisa. Thank you, Madam Chair. Everybody in the country is concerned about adverse decisions. Someone asked me yesterday what that is. It is a denial. So your doctor prescribes something, it has to go through your insurance company, and your insurance company says, no, you can't have that drug, or you can't have that treatment. That's an adverse decision. We've noticed nationally that those are creeping up, and more than creeping, going up pretty high. So this work group is to study that issue, see what we can do as a state, what policies we need to put in place to make sure that people are not being denied the health care that they need in a timely way. So with that, I move the amendments.
The amendments have been moved and second. Any questions or discussions? Yes, Delegate Shalega. It doesn't have one. I think it can be done with existing.
It thought it had one, but then they came back and said that it doesn't have one.
They can do it with existing resources. What they said. Yeah.
Thank you. Thank you for the question. Any other questions or concerns? Were we on what, on the bill or on the?
On the amendment.
On the amendments?
Yeah.
Okay. All those in favor of the amendments say aye. Aye. Any opposition to the amendments? On the bill as amended?
Move the bill as amended.
It's been moved in second. Any questions or discussion? Seeing none, all those in favor say aye. Aye. Any opposition? Seeing none, who does not want to be on the bill? All right. So we're going to, what is it? Okay.
Ask a question real quick?
Yes, absolutely.
House Bill 553, I know we passed it. Is that an expansion of Medicaid?
No, it isn't, because it's current practice. They're doing it now. So it's not an expansion.
So if they're doing it now, why do we need the bill?
Just to clarify that it's existing practice, and if there were a change in policy, that this is already covered. It's already offered, and it's already covered, so it's not an expansion.
And the amendments take out
The amendments take out the fiscal note because that was the education requirement.
Okay, because that could be a question that you could be asked.
No, thank you for the
About
question.
the
Thank you very
expansion
much.
of Medicaid, since we are, anticipating, potential cuts in Medicaid coming from the feds on some of our expanded programs.
It codifies existing
It codifies
practices.
existing.
That's a great question. And Delegate Morgan, thank you for bringing up the education part of it. I love it. This is where we do this, and I welcome it, okay? We're going to go down for a second, but we're going to go straight into, what do we have now, bill hearings? No, briefings and then bill hearings. So we're going to do briefings, but stay at your seat for a second so we could do the assignments. Thank you so much. Can you bring us down, please?